Every minute, a mother, wife, sister, daughter, or friend dies as a result of breast cancer, one of the most commonly diagnosed cancer worldwide. Good evening. Welcome to Sound Health on Lagos Television. I am Olasunbo Modupe. Today on the program, we are taking a look at how to reduce the burden of breast cancer. Stay tuned. The conversation begins after this break. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening to add our expertise to the discussion on the burden of cancer is Dr. Temitope Olatunji Agunbiade, consultant radiation and clinical oncologist with the oncology department at the Lagos State University Teaching Hospital, and she is going to tell us how to strengthen the health systems towards reducing the burden of breast cancer and cancer generally in Nigeria. Good evening, Dr. Temitope Olatunji Agunbiade, and thanks for joining us.
Yeah, thank you for having me on your program today. It's a great delight for me to be here. And as always, it's always a pleasure to impact knowledge. Thank you.
All right, according to the World Health Organization, if the healthcare systems are not strengthened, the burden of cancer is about to increase to more than 50% by year 2050. How did we get here?
Cancer burden in West Africa is significant and is rapidly rising. This is driven by population growth and lifestyle changes. West Africa, like the rest of the continent, is experiencing this rise, with projections indicating a substantial increase in cases and deaths in the coming years. The Global Cancer Observatory recorded 263,255 new cases in West Africa in 2022, with breast cancer, prostate, and cervical cancers being among the top of the commonest cancers. So, other than the breast and cervical cancers, other common malignancies seen in women are the ovarian, the uterine cancers. In men, apart from the prostate, we're talking about the liver cancer, non-Hodgkin's lymphoma. Going back to the breast cancer, the commonest type that we see in West African women is the triple negative breast cancer, which is really aggressive and really difficult to tackle. Um, the hepatitis B virus, which is associated with the liver cancer, we're talking about aflatoxin contamination in food, which is also responsible for liver cancers. Going back to the cervical cancer, the human papilloma virus infection, inappropriate social activity, and all that. So these are risk factors linked to all these cancers, the cancer burden rising in West Africa.
Why is the month of October dedicated to breast cancer awareness?
October is a breast cancer awareness month, popularly known as the Pink October. It's a month that uses the pink color and the pink ribbons to bring awareness to breast cancer, which is the second most common cancer worldwide. It helps to promote early detection through screening. Talking about breast ultrasound scan for patients or women under 40, mammo for women over 40 years. It's a month that supports research works for better treatment outcome and a cure, especially in West Africa. Campaigns highlight the significant health challenges faced by our women, focusing on increasing access to care, addressing social and cultural barriers. This month also raises awareness on implementation of preventative measures like teaching of the self breast examination in schools and communities. This Pink October is a significant period for fundraising to support our vital research works into breast cancer treatment and prevention methods. It also provides a platform for our stakeholders to review progress, renew commitments, and build momentum to address challenges and disparities in breast cancer care globally and in West Africa.
Truly, early detection is key in treating cancer. What are the signs a lady or woman must look out for?
There are certain signs and symptoms that should never be ignored by any woman, all right, or girl or girls. Every woman or female should know what the normal breast feels like. Uh, I know some people don't even know what it feels like. There are different types of breast textures. Some breasts are glandular, I mean, they're really dense, and some are really soft that you can almost feel their chest walls if you touch the breast. All right. So once you know what the normal feels like, so the moment you see something that is abnormal, you should be able to pick it up. I mean, and all the signs and symptoms include lump or thickening in the breast. I mean, your breast that had no lump before, that was not lumpy, you suddenly find a lump in that breast or in the armpits. I mean, these are really common. You see changes in size or shape of the breast. Some breasts may not even have any lump at all. You will just notice that it's suddenly getting bigger. All right. And even in some cases, you may not even see any lump in the breast. It may be in the armpit. You see a tiny swelling or a big swelling, or there are multiple swellings which are matted lymph nodes, and there may not be any swelling in the breast at all. They may also notice skin changes like dimpling or puckering, or generally known as peau d'orange. I mean, it looks like the orange peel skin. You can deeply see the edemas, the puckering in the skin of this breast. And some, it may just be redness or scaling. I mean, the breast may just look different in some areas. It may feel warm. It may just be around the nipple. I mean, like the Paget's disease, where you just see scaling. You see it scaling off and chafing off. All right. The skin becomes flaky in those areas or around the nipples. There may even be nipple changes. It could include inverted nipple. The nipple may be turned inwards. All right. Sometimes it may even be nipple discharge. It may be any liquid at all. Some it may be dark red, but in particular, it's usually, if it's bloody, or it may be bloody or it may be clear when people are not pregnant or they're not breastfeeding. So when we see this kind of signs and symptoms, we should not ignore them, all right, and we should educate our girls. And there is no excuse for ignorance. Everybody should know what the normal feels like. Tell them to check. Okay, in women, when there are certain times of the month that they may be experiencing breast fullness, like when they're ovulating or towards their period. I mean, these are hormonal changes. So you should know that, oh, at certain times of the month, the breast is fuller, or. So, I mean, let's know what the normal and the abnormal feels like.
What are some of the experiences hindering access to care and treatment?
There are several barriers to early detection of cancer in West Africa, and these are multifaceted, including the cultural factors like misconception and natural beliefs, where people believe that cancer is often associated with supernatural causes, and this kind of leads them to reluctance in seeking medical attention. Talking about stigmatization, cultural beliefs, particularly in cancers like breast cancer and cervical as well. This also discourages people from going for screening. Lack of awareness. It's very surprising that some people are not even aware. They're not even they're not even informed. They have inadequate knowledge about cancer and the benefit of screening on time. I mean, knowing that if you do your screenings, you can catch these diseases early, and there will be a better treatment outcome. We have also the cultural barrier. We're talking about the high cost of screening, diagnostics tests, and these tests are really, really very expensive for household or for individuals to be able to handle, make it a major obstacles of accessing care. Talking about limited health insurance, the lack of comprehensive and affordable health insurance coverage. I mean, which means that these are individuals have to pay out of pocket. They have to bear the brunt of this financial burden of cancer. I mean, the poverty level and economic restriction is really bad, and these patients or individuals cannot even afford the screening services at all. In terms of infrastructural barriers, there is limit to access to facilities. I mean, they are not even available. There is lack of these centers for screening. I mean, you can imagine where there is even no facility for CT scan, for CT imaging, or okay, all they can do in those areas is just X-ray, where I mean, technology has even taken us to PET imaging. In West Africa, there are like few centers that can actually do PET. I mean, knowing that if I mean, even if the disease cannot be caught by CT or X-ray or plain ultrasound scan, the PET imaging will pick up hypermetabolic activity which cannot be hidden, that will light up like a bulb. So you can imagine. So if these facilities are available, there will be early detection. Also, when these facilities are even available or they're not even, there may also be shortage of specialized staffs. I mean, there is no enough manpower. I mean, scarcity of specialized medical staffs, trained healthcare workers, professionals. This can hamper this effective delivery of cancer screening. Imagine you have a cancer center that, okay, you just have the machine, that the almighty machine that everybody's looking for, and you do not have the manpower to be able to run it. So it's also a major barrier. Inadequate equipment and supply. There is widespread shortage of necessary equipment or diagnostics help. Then poor health system infrastructure. I mean, inadequate healthcare infrastructures, including lack of basic services like radiotherapy facility, as I've explained earlier. So this kind of creates significant challenges for cancer control.
People get involved so as to make a difference as well as support people diagnosed of breast cancer?
There has to be a collaborative effort between the health professionals and the media to be able to stop stigmatization and also break the myth of screening. All right, by using clear terms, clear information, not too many ambiguous words, empathetic communication. All right, by explaining what to expect during a screening, emphasizing the accuracy, the quality of the investigation that they have to do, what to expect to address their fears and misconceptions, by acknowledging and directly countering common fears, I mean, such as fear of an inaccurate result, will it be negative or positive? You have to highlight the benefits of early detection and reason why they have to go for these investigations. We need to address the fears of misconception directly. I mean, foster a non-judgmental environment. I mean, reassure patients that screening visits are private and non-judgmental. That if anything is detected, I mean, there is a channel, there's a pathway that they will go through. Or if we detect something, we have to send you to the doctor. Biopsies will be taken, histologic will be done, treatment will be initiated. I mean, just tell them that. They need to know that if all these things are detected early, there will also be a better outcome. So, I mean, so we offer guidance tailored to the patient's specific situation and needs to make the information more relevant. So I think by doing all this, we will be able to have a better outcome. Patients need to catch these diseases early. We need to emphasize and keep re-emphasizing that if you catch the disease early, there is always a way out. And I mean, there's a whole world of difference between catching a disease at stage 1 or even pre-invasive and catching the disease at stage 4. You know that stage 4, there's nothing more you can do. You're just going to be palliative management. And meanwhile, if you catch the disease at pre-invasive or invasive or just at stage 1 or 2, you can still attain a cure by going ahead to treat those patients. So I think that the social media, the doctors, the healthcare professionals should be able to emphasize all this by going on the social media. That's just like what we're doing now. I mean, I as a health professional, I'm collaborating with with the social media, to pass this information so that people can know that there's a higher benefit in not hiding yourself. Nobody is immune to anything. I mean, nobody is immune. Anything can happen to anybody at any time. But the it then depends on how we tackle the situation. Go in early, go for your screening, catch the disease on time, go for your treatment if there is need for treatment. I mean, so there is always a way out for everyone. So as long as these informations are passed, I'm sure people will know, they'll be willing to come forward to go for their treatments. And I've seen situations whereby, patients come in, they're treated, and after they're well treated, they go back at home and disseminate this information to their loved ones. I've seen patients bring other patients to me. Oh, I see somebody, this woman came in, she knew I had this situation, and she came forward. How did I go about it during my own time? And when I explained, patient is willing to come forward. So we should be able to do this for our patient. I'm sure that if we continue at what we're doing currently, there will be a better outcome for our patient.
Has limited access to treatments been a challenge in your years of experience?
Advances in cancer treatment are not widely accessible in West Africa, truth be told, um, facing significant barriers like limited infrastructures, high costs, shortage of specialized staffs, as earlier highlighted, I mean, which altogether leads to late diagnosis and incomplete treatment or care. I mean, however, recent improvements includes, I mean, that gives us hope. They include successful establishment of advanced treatment centers in West Africa and some part of West Africa, like Nigeria, even in Ghana. The increasing use of telemedicine and AI for remote consultations. I mean, we have some, like I mentioned earlier, some consultation online facilities and the growth of patient advocacy and support groups that improve awareness and well-being. I mean, they are a source of joy knowing that this will lead to better diagnosis, treatment, and outcome of cancer care.
Are there evidence-based strategies to reduce the burden of breast cancer?
Regular screening, it's of utmost importance in early detection, treatment, and prevention of breast cancer. I mean, every woman should know what the normal feels like to the abnormal breast tissue feels like. So every woman should learn to do a breast self-examination, and we should teach our girls how to do a breast examination, which should be done every month. You know what it feels like when you're ovulating and towards your period, or when you're not, when you're even in resting phase of the month. So women under 40 years are encouraged to do breast ultrasound scan. Even our girls can do breast ultrasound scan. Women over 40 years are encouraged to do mammo. And even now, there are even a higher technique, which is the breast MRI with a high resolution. It can pick a really tiny lumps that are even really early. So it is very important to make sure that we all do our breast screening, so that this can help us to prevent late detection, and also this will improve a better treatment outcome if these diseases are detected early.
What do you think the government can do to reduce the gap to access and care?
To bridge the access gap for specialists and diagnostic tools, government and communities should increase funding for diagnostics. I mean, talking about prioritizing diagnosis and national health strategies, they should increase fundings and implement cost reduction. I mean, like bulk purchasing, they should strengthen diagnostic network by establishing and corporate national laboratory networks that are integrated into broader regional diagnostic ecosystem. I mean, just to optimize resources for all these facilities, and by so doing, this can facilitate disease surveillance, as in seeing in all those Lassa fever testing and co in Nigeria, particularly in Nigeria. All right. So, talking about improving regulatory framework. All right, there should be the collaboration with the regulatory bodies, the industries, international organization, um, to create a standardized guidelines, streamline processes, and improve the affordability and accessibility of all these tools. There has to be support technologies, you should invest in telemedicine solution, home health application, so that those areas, those remote areas can be connected, with specialists and enable continuous health monitoring, thereby improving access to primary and specialized care. Like the likes of Oncopadi in Nigeria, where patients can speak with doctors online and sort them out. So, these are collaborative efforts between doctors, the government and the communities. All right. So, when this happens, this promotes health literacy, and it's also vital for improving access and uptake of the services.
As we wrap up now, share with us some final words with women, especially in the society.
The key message to women in this month of October, which is a Pink October, Breast Cancer Awareness Month, is to prioritize their health by practicing breast self examination, know your body, be familiar with your breast, and look for any changes in size, shape, or skin, texture, or lump, whatever it is. To perform monthly self examination, know what it is while showering or lying down in bed to detect any unusual changes. Get regular screenings done. Go for your screenings. Consult to the healthcare provider to determine the appropriate age to start. Basically, I know that under 40 you can go for breast ultrasound scan. Above 40 you can go for mammo. And in a situation where there are controversies over what and what not, breast MRI can be done. And peradventure we find anything or anything is picked up, please seek medical attention, see a doctor as soon as possible, because early detection is crucial and it saves lives. It gives a better treatment outcome. If you catch a disease at a stage 1 or pre-invasive state, you can attain cure than when you find it at a later stage. So the key message today is prioritize your health and be health conscious. Go for screening, detect anything, go for treatment on time for better treatment outcome.
All right, be familiar with your body, practice self-examination, and seek medical help early enough. Dr. Temitope Olatunji Agunbiade, consultant radiation and clinical oncologist with the oncology department, LASUTH. She has been telling us what exactly the society can do to reduce the burden of breast cancer.
Thank you. It's been a pleasure being on your program. Thank you so much.
Thank you so much for your time. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. We have been discussing the burden of breast cancer in Nigeria and how to reduce and how to increase awareness and support to people diagnosed of this condition. You need to prioritize your health, seek medical help early enough. Early detection is crucial in the treatment and care of breast cancer. This is why we say thank you on today's episode of Sound Health. If you have topics you'd like us to treat or you have comments and inquiries, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.